Hello, everyone. This is Alabjeet Flora from the Wednesday Show Talk Show, and today we have an additional show, especially for breast cancer. We are acknowledging this very important cause, and we need to bring information and talk more openly about this. So, thank you so much for joining us, all the viewers. You can write in your comments from where you're joining. We are Pothos Events. We are a Sweden-based company. You can find us on our website, www.pothosevents.com, on our Facebook, Pothos Events, and also we have our own YouTube channel. So please follow us for very informative and very, good personalities that have come on this show. Regarding today's show, it's breast cancer. Women, we choose to live in the myth that breast cancer will never happen to us. We look at it as being just another form of deadly cancers like many other cancers of liver, lungs, etc. Is this awareness just enough? Do you think we must shy away from discussing this topic? Because when cancer shows up in our homes, our friends' homes, amongst our relatives, we realize its intensity and develop fear to see these families feeling helpless, health of the patient deteriorating, and young children losing their mothers. How I wish I wouldn't be talking on not so pleasant stuff that you want to hear. But I just am sharing facts with you. Today, we want to help that even one person to make that woman aware that she can be treated and can be breast cancer free if detected on time. Woman means power. Woman means make the impossible possible. Woman means nurture. Woman means unconditional love, and so much more. And yes, we are the sole reason behind the human race flourishing. And we need to be protected. We need to be aware. And we need to know that we can be saved with timely treatment. Today, I'm very grateful to Dr. Trishna Shikhare, who's joining us from Singapore. Dr. Trishna is a radiologist specializing in breast imaging. Her work revolves around diagnosing breast cancer using screening tools such as mammogram, ultrasound, or MRI. She has recently completed a year's fellowship in breast imaging from University of Toronto and worked at Canada's biggest cancer hospital. She is determined to spread awareness and help detect it at an early age to have the best possible outcome. She emphasizes to discuss openly as breast cancer today is the most common cancer in women in all ages globally. Everyone, please help me welcome Dr. Trishna Shikhare to the Wednesday Talk Show. Hi, Trishna.
Hi, Alam. Thank you for the lovely introduction.
Thank you so much. Thank you for coming and making it possible for us to discuss this issue. You have been so passionate, so thank you so much for being here.
Thank you for having me here on Pothos Events and the show. It has been a great show, and I've been following all your episodes. So wish you all the best. And I'm glad that we are talking about breast cancer today. So without wasting a minute, I would just like to start off on what we are trying to head towards and what we want to discuss.
We would like our viewers to know also about you more, and if you can tell us more about yourself. So thank you.
So hi everyone, I'm Dr. Trishna and I'm a radiologist by profession. I work at Kutekot Hospital in Singapore and I specialize in breast imaging. My work primarily revolves around, as Adam just said, diagnosing breast cancer, early detection of breast cancer, and interventions related to breast cancer imaging. I'm here today on a voluntary basis just to raise awareness of breast cancer. Give me a moment till I bring my... Can you all see my screen?
We can see the slide, yes.
Okay. Yeah. Okay, so I'm here on a voluntary basis just to talk to all of you about breast cancer. So as Alam mentioned, I often come across women and they have, this is the biggest myth, I guess, which exists around breast cancer, that breast cancer or any cancer for that matter runs in families. So many of them say, oh, I don't need to worry. There are no cancers in my family. But we all need to understand that 75% of breast cancers occur in women with no family history, no additional risk factor. So I would like to state it as the most important risk factor for breast cancer is being a woman. and also growing older. So these two facts you cannot change. And, and that is why breast cancer is the most commonly occurring cancer in women at the moment worldwide, with over 2 million cases of breast cancer getting diagnosed each year. For example, in 2018 alone, there were 2.1 million cases detected for breast cancer, which is a huge number. And if you look at the cancer death rate, 627,000 women died of breast cancer. So breast cancer single-handedly is responsible for causing the greatest number of cancer-related deaths in women all over. In every 69 women of her 40s, or 1 in 43 women in her 50s, or 1 in 26 women in her 60s, it just keeps on increasing. The risk keeps on increasing for getting breast cancer. Today, in this next 30 minutes, I try to target to talk more about or cover these areas briefly. What is breast cancer? What are the risk factors associated? What are the ways we can prevent breast cancer? And what is the role of early detection or screening, and how can one do it? What is dense breasts, and why is it important to know for a woman what is her breast density, and how would one do a breast self-examination, and what is the importance of it? Over to you, Arun.
Thank you. And what is breast cancer? Can you elaborate more? And what are the risk factors associated with this this cancer? And are there any ways to prevent this also?
Yes, I would like to bring to notice that many a times we just dismiss that breast cancer is something which is life-threatening, but we all need to understand what is the breast cancer disease journey or the spread. How does it happen? It is basically starting with a group of cells which grow abnormally. So when there is a group of cells in the body, in the breast, which differentially grows than the others, it loses control over the growth. And then it forms a lump or any abnormality in the breast, which is damaging the adjacent breast tissue. It is initially localized, as you see in these images. It is initially localized. I just wanted to check, is my cursor seen?
Yes, we can see the cursor.
Okay. It is initially localized to breast, and as it slowly grows in size, it then happens to spread outside the breast in the adjacent lymph nodes, and after which it spreads outside. If it is going undetected, if it is not treated at this moment or detected at the moment, it goes and spreads to adjacent lymph nodes, to lungs, to liver, to visceral organs, including brain and bones. And this is the point when it becomes dangerous and life-threatening. But we also have to understand that many cancers can be found before this actual spread happens. What does that mean? That means that we still can help women save their lives by early detection. So there are two ways to look at it. One is prevention, and the second is early detection. When you talk about prevention, we need to know what causes it. What are the risk factors which cause it? So as I mentioned, 75% of cancers occur in the women who have no additional risk. But in addition to that, there are certain factors which can increase women's risk to get breast cancer, which include, few of them are ones which do not have any control upon, like these are beyond our control. For example, increasing age. If you are a carrier for genetic mutation, or you have a background history of chest wall radiation received for Hodgkin's disease, or any woman who had her period which started earlier and had a late menopause, thus increasing her duration for hormonal exposure, or women who do not have children, unfortunately, also have a higher risk, or a woman who had a breast biopsy for any reason with an outcome showing atypical cells or atypia. So these are factors which you really can't control. And if these exist, definitely you are at higher risk for breast cancer. But there are some factors which are lifestyle related. And here comes the role of our intervention or our proactivity in this. So to put these lifestyle factors positively, if a woman after her menopause is on hormone replacement therapy, and if she is kept on a minimal estrogen or she does not use hormone replacement therapy, she reduces her risk for breast cancer. A woman, if she puts herself on a low-fat diet, minimizes her alcohol intake, she can reduce her risk for breast cancer. If a woman chooses to do regular, moderate physical exercise, it can largely help to reduce one's risk. If a woman chooses to not to smoke or to keep her body weight in a healthy range, So a healthy body weight is also a factor which can reduce. So elaborating on these lifestyle factors, I just want to say that if we choose to start working on these factors, which are modifiable, which are lifestyle related factors, a small change, even started as early as in childhood or young adulthood, it is as important to do it because it can control or it can bring down somebody's risk by 68%. Nevertheless, even if you start midlife, you can reduce your risk for breast cancer by 50%, which is significant. Things like walking. If you choose to do or choose to walk 30 minutes each day, give that time for yourself, look after yourself, you lower your risk for breast cancer by 20%, which is a huge number. And not just breast cancer, by walking each day, you are lowering your risk for other diseases such as colon cancer, heart disease, stroke, osteoporosis, and also depression. So I think we all need to, it's high time we bring ourselves to do these proactive, healthy lifestyle changes. Alcohol, nobody likes to listen to this, but still, one alcoholic drink a day, let it be any form, a wine, a glass of wine, beer, or any spirit, increases a woman's risk to get breast cancer by 10%. If a woman breastfeeds combined, all her pregnancies combined for 1 year, she lowers her risk by 20% for getting the breast cancer. Talking about weight loss, if a woman manages, an overweight woman loses 10 pounds of her weight, she is lowering her risk for breast cancer by 10%. And if she drops by 20 pounds, she lowers her risk significantly by 50%. So it's important for us to know that not just the non-changeable factors, but there are a lot of things in our hands still to prevent. Also, if you have hormone replacement therapy in place, and if you choose not to take it, it has been studied extensively that by not continuing hormone replacement or with low estrogen, the hormone levels were low and the 15% drop in the cancer rate was seen. Over to you, Alan.
Thank you, Trishna. So informative. I have been sharing your slides, and I think everyone should take notes of it. What could be the signs of breast cancer?
Okay, so breast cancer can present in a multitude of ways, right from something like thickening, dimpling, but just to list them, it is not enough to understand. So to comprehend it better, I would just like to present it in a picturesque way. This is a cute videographic or a photographic, I would say, which shows how differently breast cancer can present. So this is from a website called knowyourlemons.com, which have a lot of education material if somebody wants to refer to. And these are the various ways. For example, if a breast cancer can present as a thickened area on the skin, which you can feel as skin thickening, or it may present as dimpling of the skin surface, as you can see here, or nipple crusting, where there is difference in the color and there are some crusts of skin which keep peeling off, or a small area or a large area of redness or warmth, which look different from the rest of the breast, or a nipple discharge. So not every nipple discharge is abnormal. If you have white grain or discharge which is only seen on compression, it is not to be worried about. But if you have a clear or a blood stain or a reddish discharge which comes out on its own without even squeezing or without any compression, such discharges are worrisome and need to be evaluated. If a woman has some skin sores which are not healing, or she has developed a new palpable focal lump or bump, or she has some veins which look suddenly prominent than before, or change in the appearance of the nipple. So nipple which was previously normal then later becomes sunken, or that is also called nipple retraction, she should be worried about it. But I would like to make a note here that not every nipple look the same. And there are some nipples which also have developmental structure which is flattened or sunken. So it's very important for everyone to know that doing breast self-examination is extremely important to notice these fine changes in your appearance and as well as the texture of the breast and nipple areas. Sometimes the whole breast looks a little different in terms that there is increase in size, a new shape and size of the breast, which should a global change in the breast, different than the other side, which you should be vigilant about. And sometimes breast cancer can just present as a thickened orange peel skin, we called it, or in other words, the orange appearance of the nipple or the surrounding area, or a breast lump which is hard and non-tender. So these are the various ways in which a breast cancer can develop or show up, for that matter.
Yeah, so screening is important. So, what do you think? At what age women should start screening for breast cancer?
As I said earlier, screening is extremely important for early detection. So there are two aspects to breast cancer control. One is preventive and one is detection. Prevention is not always possible. So what is the next possible way is to detect it at a level when it has not spread outside the breast. And so as to do that, we need to have tools for screening. The time tested for now over decades has been the mammographic screening or imaging screening. And at the same time, the other screening tools include breast self-examination. So why screening? This is a very important question which we all should ask ourselves or address this question, because it has been proven beyond doubt with all large randomized trials across the world that screening for breast cancer helps to save lives, and it increases the number of life years gained by for a woman. It helps to detect cancer at such an early stage when it is limited to the breast, and thereby the treatment provided is more effective and less harmful. So it is like when a woman has a cancer limited to breast, she can be treated with lump removal. But when it is beyond it, when it is large enough and it is not detected, she has to undergo breast removal, that is mastectomy in simple words. She has to, in either when the mass is so small that the lymph nodes are hardly affected, they are not even involved. Or sometimes when they're involved, if you're detecting it early, she can have a minimally invasive surgery with like sentinel lymph node biopsy instead of having a more aggressive axillary lymph node dissection, which also leads to post-operative lymphedema. So basically, by detecting it early, you are saving life and increasing the number of life years gained. And that is the reason why you should do screening. Large trials or large studies have shown that women who do regular screening are 40% less likely to die of breast cancer than those who do not do mammographic screening. I will talk about in details about it when I am talking about what time to start. As you said, like what time should a woman start screening?
Yeah.
So there are a mixed bag of opinions and few school of thoughts. For screening in every country, there are some national screening programs which run, in which the woman is asked to come for screening mammography at a particular age, starting from a particular age. But recently, with the kind of research which has gone back into what happens when you do screening early versus what happens when you do screening later, it was found by these major three trials and few more as well, but I'm just highlighting these three here to emphasize that all these three trials showed that when you start doing the screening earlier, you are saving most lives. Why 40? So 40 is a sweet spot where the incidence of breast cancer jumps from being lower to significantly higher. So for example, as I have mentioned here, the incidence of cancer in age of 40 to 45 is 2 times than that which was seen in 35 to 39 years age group. Similarly, the incidence of breast cancer in 45 to 49 is again 2 times that seen in 40 to 45. So in the age group of 40 to 49, there is a significant jump in the cancer incidence. So much so that 1 in 6 of the total cancers which are detected overall belong to the age group of 40 to 49. So by doing screening, you are able to detect these cancers and thus save maximum lives. So they found that the years of life lost to breast cancer are highest in the women of 40s. And if you do screening, you can save approximately 40% of all the years of life saved by mammography if the woman is in 40. So to talk about, this is about what happens in 40s, but we also have to understand that every life lost to breast cancer is precious. But when we talk about young women in 40s, they have young children to look after, they have elderly parents to look after, they are the working force. And when these women are not screened just because they are young enough and they lose their life, a family loses their mother, a family loses their wife. It is unfortunate that this could have been saved by screening and early detection, but just because this was not done, the cancer grew to a stage which could not save life.
Absolutely. Viewers, please take note of this. If you're even close to 40, please start, taking this very seriously. Go get your examination done. Some countries do, like Sweden, the government is very proactive and they do all the screenings. So if not in any other country that you are viewing this, please do take care of this. Thank you so much for that information. Also, how do we do the screening? And what are the screening tools that women should be aware of? Because we do the screening, but it's good to know what's really happening there.
So yes, Alam, it's very important to know the techniques or the tools which we do screening. As I mentioned, the time-tested one is going for a mammographic screening. And with a modern digital mammography, we have either 2D mammography or a three-dimensional mammography, which gives us a better picture of the thin sections of the breast taken, and we can actually see in details of the breast tissue, and also cancer detection rate has increased. In addition to the mammography, which is also equally important to do breast self-examination. So there is a fine difference between breast self-examination and clinical breast examination. Breast self-examination is done by the patient herself, whereas the clinical examination is done by the doctor when you are seeing your doctor. So it is very important for a woman to be aware of how to do it, how to do a breast self-examination, the importance of breast self-examination, because you see a doctor once in a year, but you see yourself every single day. You are with yourself. So you have to be your own health advocate. You have to be knowing how your body feels and looks. It is not something to overlook. You should not be the last person on your list. So it's very important to do breast self-examination. Towards the end, I'm going to show slides to explain what is breast self-examination and how to do it. Other tools for screening also include, in situations, are ultrasound breast and MRI, which are definitely important breast cancer detection tools, but they are not widely applied as mammography is, given the fact that these are reserved for a particular category. For example, ultrasound is reserved for dense breast evaluation as a screening tool, as an add-on, or MRI, which is very sensitive for breast cancer detection, but it cannot be applied to masses given the cost and the doing of this MRI study. It's not technically feasible to get done. So it is reserved for high-risk cancers, women who have a particular percentage of lifetime risk or higher risk, they are doing MRI screening. So but you should always be aware that these are the tools which you can use for yourself for screening. But you should be following what is the national program for your country.
Yeah, it is so important. But I know even through your experience, that women, they don't go for these mammographic screening, and I would like to help them. So what do you think, what is stopping them from just coming there?
I totally hear you, and I agree with you that there are a lot of myths and facts which exist around mammographic screening. So I really feel the necessity of being aware of these myths versus facts. We ponder on the myths so much that we never work towards knowing what are the facts behind. And it's really high time we empower each other by knowing what are the facts, where the truth is, and really do we need to know, is really mammography harmful? So to summarize, this slide is a little busy, but I'm going to go through and walk you through each one, what I feel and I thought came across in my experience, as well as why experts don't think these are harms, but there are benefits of mammogram. So most commonly what I come across is women saying that I really don't want to do mammogram. There's so much radiation involved, and why should I expose myself for radiation? And my risk for radiation-induced cancer is increasing. So I would really like to make everyone understand that when we're talking about radiation, it is not a concern for experts. And why so? Because we are living in a world which already has a lot of natural background radiation. I am not sure, but are we really aware of it? we are not, by not even being aware, we are every day exposing ourselves to a background radiation, which includes cosmic radiation, like the one from cosmos, from the earth and sun and moon, the ultraviolet radiation, the radiation that comes from the air from radon, or the radiation that is coming from the soil and the rocks, radiation that is coming from the water, it has dissolved radioactivity given the industrialization, radiation which is coming from organic matter. So this all contributes to the natural background radiation. So talking about radiation from mammogram, the radiation, what is it? Let's talk about the facts. What is the radiation dose actually for the mammogram? So when you do one mammographic examination, which includes 4-view mammography of two sides of the breast, like two breasts, 2 views each, the radiation involved is very low. It is zero 0.4 millisievert, that is a radiation dose. And if you try to equate it in terms of something else, like what we are actually exposed to, it is equivalent to a natural background radiation one would receive of over 7 weeks' time at a sea level. And also, we have to understand that it is also equal to taking 5 transatlantic flights. So even taking flight is like exposing yourself to radiation. It is also equal to 3 to 4 weeks staying at a higher altitude where there is more radiation, background radiation. So we don't avoid flights for radiation. Then why should we avoid a mammogram for radiation? I'm a radiologist. I am allowed to get exposed to 50 millisievert of radiation every year, and that too safely. So 50 millisievert accounts to be doing it's like doing 12 to 13 mammogram. So I'm not advocating for doing so many mammograms. I'm just saying that when 12 mammographic radiation dose is safe, then a 1 radiation mammographic dose in 1 year is definitely safe. So we should really erase this from our minds, and we should empower other women who say so by telling them the facts that the radiation involved is really low with this modern day radiation, modern day devices, and we should not be worried about it. Other thing which deters people from, or women from, doing mammogram is the pain involved. I would not say it is a myth. It is a fact that there is pain. But why there is pain? It is because of the technique. Because whenever do you mammogram, for those who have never done a mammogram examination before, when a mammogram is done, the breasts are compressed in a mammogram machine by your radiographer, slowly, sequentially, to a point where we are optimally compressing the breast and obtaining the image. This compression is controllable. It is very small period, like it's for a few seconds of compression. So, and it is released immediately. So if patients do have pain from mammogram, it is to be understood that it is a short-lived pain. And you can work around this by reducing the compression, although it may lead to a subperfect mammogram, but subperfect mammogram is still better than no mammogram. And you can work around the pain by having a mammogram at a time of a cycle in your menstrual cycle when the breasts are less tender. For example, timing it after your cycles, after your periods. You can get it done. Or you can also reduce your sensitivity by tapering the amount of caffeine you are taking from before mammogram. Don't stop it completely and have headaches, but you can also taper it. So my point to make here is that pain from mammogram is a short-lived pain. It should not deter you from doing a mammogram. You should rather tell this to your radiographer when you go next time that less compression should be used. False alarms. So what is this false alarm? When a woman has a mammogram and she has some abnormal finding, that does not mean that every abnormal finding on a mammogram is actually a cancer. Sometimes just the appearance of breast tissue may be looking abnormal. Sometimes a benign finding, that is a harmless lump sitting there in the breast, also can lead to an abnormal finding. But as a part of evaluation, whenever there is something which is seen abnormal, we call back the patient and we do some extra tests. And this involves some additional views or doing ultrasound to confirm that there is nothing concerning. So women have to undergo some extra tests. And if the ultrasound still shows something, they still need to undergo a needle study, which is like putting a biopsy needle, doing a needle biopsy, putting a needle in under local anesthesia, taking a sample of tissues from the breast, sending it over to pathology, studying it under microscope, and then knowing that it is cancer or no cancer. So for example, if you take on an average, if 1,000 women are screened, out of these 1,000 screening mammograms, there are roughly 70 women who will be called back, and they will have to undergo, as a part of standards of practice, undergo extra tests. And maybe around 16%, so 15 to 16% or 10 to 11 women out of these 70 will be uh, undergoing a needle study just for confirmation. So once the needle study is done, it is not necessary all 10 of them or 11 of them will have cancer. It generally, it's like the cancer rate is so that only 4 of them or 5 of them will actually have cancer. So the 70 women who came back, 65 had to undergo the process of reevaluation. So they have to undergo this anxiety of going through extra tests, and they are not comfortable with it. But you look at it, that was it unnecessary? Really, these 65 women coming back, was it unnecessary? You could save 5 lives by diagnosing or detecting 5 cancers. The rest of 65 who do not have cancers still had an alarming mammogram study. They are at peace after dedicated and thorough evaluation. So this short-lived anxiety is much, much more manageable than the shortened life because of a late cancer diagnosis. So let's put it like that. Alarm is not a false alarm. Alarm is an alarm. You have to work towards it. And if you can find a cancer, even one woman can be saved from dying of breast cancer, you are not doing something wrong. So we should not look at false positives or false alarms like that. There is another thing which deters the people from doing mammogram, is that mammograms sometimes do look normal, but that actually they are not normal. So what I'm trying to say here, it may be a little confusing for everyone. So for example, a woman with dense breasts, I will tell you that in short while, but women who have dense breasts,
we would like to know.
Yes, the mammographic sensitivity is very low. And they do get a normal result, but actually they may harbor a small cancer, but the density of the breast is not allowing us to see that. In such situations, how common are these scenarios? They are very low in incidence, like as low as less than 1%. And you can still work around these. If you have a dense breast, you should be getting additional methods of screening involved, like ultrasound. For example, you can be more sure that there is nothing else which is getting masked by the density. So you still can work around. So there is nothing, again, like false negative or overdiagnosis. So overall, we see the benefits of the mammography are largely outweighing the harms or the myths, and they are saving lives. So why not to do screening? That is the bottom line, that screening mammography should be advocated, and you should advocate for your own health.
Wow. Very, very good myths cleared. You spoke about dense breasts. So what is having dense breasts, and why is it important to know about it? And also, what should one do if they have it?
Yes, Alam, it's really, really important because even in my friend circle or family, there are women who do not know much about dense breasts. And for that reason, I would just like to put forth the mammographic appearance of breasts here. So let's go and for a moment understand what is the composition of breast. So breast is composed, in a very simple language, breast is composed of glandular structure, that is the milk glands, of fat and the fibrous tissue in varying proportions and in varying combinations. And every combination is a normal combination. So sometimes women do have predominant fat in their breast. That's why it looks like this, that is predominantly looking black on mammogram. So these are the fatty breasts. But sometimes, or many a times, women do have varying amount of this white area, which is the glandular area and the glandular element. So when the fibroglandular and the fibrotic element, that is the milk glands and the fibrotic elements, is more, the breast look a little more whitish. And in varying proportions, if you have more of this tissue, the breast looks denser. So these two on your right-hand side, C and D, these are the types nomenclatured by the standards of categories of breast density. And these two on the right are the dense breasts. And this is an extremely dense breast. So when you have dense breasts, what happens is, why you should know about dense breast, because when a woman has a dense breast, she is automatically having a higher risk, as high as 5 times higher risk for developing breast cancer than a woman with fatty breast. So although it is normal to have like 40% of the women of age 40 to 74, that is screening age, have dense breasts. So it is as common as that. So it's just less than half or just less than half the women who do screening have dense breast. So everybody should be aware of their density. And to know the density of the breast, you have to do a mammogram. No clinical examination, no breast self-examination. Your doctor cannot just do an examination, palpation, and tell you that you have dense breast. Only mammogram can tell you what is your breast density. And it's extremely important to be aware of it. Because if there is a cancer in such dense breasts, the density itself, that is a white part itself, masks it to make it difficult to diagnose. And by the time the cancer get detected, they're already large in size and often already have spread to the adjacent nodes. And a woman with a dense breast is actually 18 times, which is a really, really high number, higher risk of developing interval cancer. So another terminology to minimize the confusion around it, interval cancer is basically if a woman had a screening mammogram done last year and she gets another screening mammogram done this year. The last year's mammogram was normal and this year's mammogram is showing some abnormality. So, and that turns out to be cancer. So the cancer which developed in between two screening mammograms is the interval cancer. And in a dense breast, the propensity or a risk of a woman having this interval in between 1 year period cancer is 18 times higher. Now you tell me, if you don't do screening and you don't do a regular screening and you choose to do after 2-3 years, you are going to miss out on there's going to be a significant delay in the diagnosis of this cancer, which could have been prevented.
Yeah.
Let me tell you, dense breast is the stronger risk factor than actually the family history for breast cancer. It is that stronger risk factor. And we don't even know our densities.
Yeah.
Do we have done our mammograms to know our density? We are living in a world of illusion of not until actually the diagnosis dawns upon us. No, that's too late. So we really need to empower ourselves and others that we need to know our densities. Woman with dense breast, if at all has breast cancer, she is at risk of having another breast cancer in the opposite side, and also another recurrence in the same side. So she's getting hit from all the sides, and she's not even aware of it. So it's very important for everyone to know our density of breast. So to simplify how dense breast is masking, I've just put up two pictures here. These are mammographic appearances of fatty breast on your left and dense breast on your right, with fatty breast appearing black and dense breast appearing predominantly white. When a cancer occurs in a fatty breast, a cancer looks white like that. You can easily detect it given the contrast of your breast, and it's easy to detect. But if the same thing happens in a dense breast, imagine you are looking for a snowball in a snowstorm, you can't find it. There is a high chance that the cancer will get masked. It will get hidden in the whiteness of the breast density. And that is the reason why you need to advocate for another screening test, such as an ultrasound, to be sure that there is nothing else happening. That is the reason why you need to still do continuous regular mammogram, not to miss anything. So, as you said, as you asked, what are the things which a woman should do if she has dense breast? Firstly, she should not panic, because it's a very, very common thing to have dense breast. And having a dense breast is not like you got an abnormality or you have got a field for cancer. No. If you have a dense breast, you should be just very breast aware. You should be very proactive. It's like another thing which you have as a part of it. You have to respect your body the way you are being made. And it's just about taking care of yourself and taking that extra step to look after your health. You have to continue doing your regular mammograms, because sometimes ultrasound will not be showing. Like, some people have a myth again that because I have dense breast, I don't do mammogram. Anyways, they are of no use. But let me tell you, there are some cancers which are seen only on mammogram, even if it is dense breast, such as calcifications, purely calcifications. There are some cancers which are picked up on mammogram and not on ultrasound. Some are picked up on ultrasound, but not on mammogram. So dense breast women should always continue doing regular mammogram, should religiously do regular breast self-examination, ideally every month. There are even apps for this, there are some websites which have breast self-examination apps. They remind you every month what time of the month you should do your breast self-examination. And I hardly know anybody who is actually so proactive who's doing the breast self-examination.
Yeah, I think people are not aware also. So,
yes.
yeah.
I will share a few websites which I think it will be really
That will be
informative
helpful. Yeah.
and educative. It has been a source of education for me as well. So definitely, I would recommend that at the end of these in this talk. So even if a woman who has a dense breast and gets a normal mammogram, and she after a while she feels something which is different on a regular breast self-examination, she should not hesitate. She should see a doctor, get it evaluated. Thing is that keep your threshold low. Don't sit on something. Don't ignore your findings. You should work your best to modify your lifestyle factors. You have to increase your chances by reducing your risk. And that includes having a healthy body weight. I mean, how much ever you emphasize on this factor, we are losing the power of the factors which are in our hands. We take it so much for granted that, oh, it's okay to be overweight. Oh, it's okay not to exercise. But we really don't understand the power of these tools. By keeping your body weight in rhythm, your body in rhythm with regular moderate intensity. I don't say very hardcore enthusiastic exercise, but walking, just doing minimum exercises is good enough. Being physically active, limiting your alcohol intake, and also decreasing your hormone use. Also, be aware whenever you see a doctor, talk about your density, talk about what are the associated risks. Do you have any additional risk factors? Go and find out your risk assessment and look for a best screening option that is available for you. It is very hard to generalize the screening option, but it's best to tailorize it the way you want it in whichever country you are. And to improve your cancer detection, advocate yourself, advocate for additional screening such as ultrasound or MRI. It does sound too exhaustive, but if you really look at it, it is only two things. One is being sincere with a breast self-examination, and one is doing regular screening mammograms or screening studies. These two things are the things which a dense breast woman has to. It's not about just dense breast. It should be done by everybody. But the underlying message is that with dense breasts, you need to be aware of the risk and do things accordingly.
Yeah, great. And also, I am aware, and we can do breast self-examination. How does one do it? And could you just help us, give us more insight so that we can help ourselves also, and for early detection of this?
Sure, sure. This was something which even I felt that it's very important. You are a doctor or a no doctor.
Yeah,
Knowing as a woman what is to be done is very, very basic. And it's no shame in learning how to do it. It's very, very important to say that I don't know how to do it, and only then you will be going ahead and doing it. It's not just rubbing it off that, oh, breast self-examination is just examining your breast. So many a times you go and Google a breast self-examination, you see a lot of videos or photos which women are with clothed and they are trying to examine the breast. It's not that what is important. You have to understand there are certain positions and certain ways in when you are doing the self-examination should be done technically correctly. When talking about a few things such as how often should it be done, it should be done at least once a month. At least once a month. You may want to do it often. What is an ideal time of a cycle to do it? You can do it just after your periods when the tenderness is minimal. It's easier to do a breast self-examination. It's best done in lying down or standing position when you're having shower. With your hands in different position, you can keep your hands by your side, by your raised above your at the level of your hands, or raised above behind the head. I'm going to show you pictures for that as well. And
great.
what are you looking for? So basically, what is most important is that you need to know how your breast feels and how your breast appears over the period of time, has been looking and felt feeling like, so that you can spot out any difference than normal. And in this difference may be either focal bulge, maybe focal skin change, or a global appearance which has changed, nipple changes, or the skin which is appearing differently. So talking about the positions, we always ask for doing the breast self-examination in different position. Why? Because when your arms are on the side, your breasts are not completely pulled up. When your arms are on elevated position, you can actually see some deformities or puckering of the skin is accelerated and enhanced when you can actually see dimpling of the skin by breast being pulled up. So these outer abnormalities, and many times the common areas affected by breast cancer are the outer breast. So outer breast abnormalities are best appreciated when your hands are above your head. When you can also keep your hands on your waist and taut your chest muscles so that the underlying muscle is pulled up. And if there is any underlying breast abnormality, it becomes more evident. So what are you looking out for is change in the size and shape of the breast, any dimpling of the skin, or change in the appearance of the nipple. Like if there is any unilateral, that is one side looks different than the other side, one side looks retracted, or one side has a crust on it, so or one side has a discharge on it. And for the discharge, you have to gently squeeze and try to see if there is any discharge. And look out for the color of the discharge, if it is clear or bloodstained, and if it is occasional or it is episodic. Sometimes you get multiple episodes of non-squeezing related, that is spontaneous bloody nipple discharge, which is a sign of cancer. It may be at any age. So talking about the technique of doing it, when you are in the lying down position, it's best to do it in this way. Put a pillow below your shoulder and chest to give a firm pressure and firm surface for the breast. Keep your hands behind your head, and then make these three fingers, bring them together, hold them together flat. Then you, with the right hand, you can check on the left breast firmly. And as you see here, you should always go from outside in circles. Can you see my cursor? Yeah. Alam, am I audible? Okay, I think I'm audible. And you should always go from outside to inside in circles. And also the same position, same technique you can do in shower when your hands are soapy, because it's easier for the hands to slide along the skin surface when you are in shower. So these are the two ways. We have to repeat the steps for the right hand doing the left side and the left hand doing the right side. So these are the ways which you can do the breast self-examination.
Okay, thank you so much for these very, very useful tips. And we can, use them and also detect and help ourselves. So before you go, Trishna, could you summarize, and give some message, some advice to all the women out there who have been listening?
I thought I lost you in between. I could not hear. We lost contact. So my take-home message, I wanted to keep it short, but I think we have already crossed the time limit.
Yeah, but this was important, so I did not stop you. I'm like, this message needs to go across.
Thank you so much. I really, actually, today is Navratri starting, and it's such a nice day to have this talk done, because it's like empowering each other, empowering our sister concerns and every woman with information, which is really, really, really which is the best way to do a Shakti Dan. And I really feel so. Summarizing the entire thing is difficult, but I'm just going to give you some few things which I think should be emphasized, that every woman should have a regular screening, and ideally starting at 40, ideally annually, or at least as often as allowed by the national screening program which is run in the country. You should religiously do your breast self-examination. Don't neglect it. You should do it at least once a month. Do not ignore any signs which you think which are occurring new, like a palpable concern, a lump, or a change in the nipple, change in the appearance around the nipple. Do not panic if you have done a mammogram and you're called back or there is some abnormality. Not every abnormality on mammogram is a cancer. So you should diligently get it worked up, diligently evaluate it, and be at rest that this is not cancer. Be vigilant and not ignorant. Basically, you have to be breast aware for any changes. And if you have dense breast, don't panic. It is normal to have dense breast. It's very common to have dense breast. But you should remember the risks associated, and you should become more proactive towards advocating for yourself to screen and to do additional tests like ultrasound. There's also one thing which I wanted to tell is online risk calculator, which I'm also attaching the link for, which you can calculate your risk, lifetime risk for having breast cancer. And if you happen to have a higher risk, like more than 25%, more than 20%, you should be seeing a doctor to get additional tests like MRI. So the most important take-home message which I feel is we should find the cancer before the cancer finds you.
Absolutely.
These are the few important links which I wanted to share with you all. These are really useful sources of information, and that is the software for which will help you to very simple way to understand your risk for breast cancer, which even everyone does it, including me. I have done it. So would really like you to do that. I'm just going to leave it at this. And thank you,
Yeah.
Alam, for this.
Thank you so much, Trishna. Our viewers can take a screenshot of this, and if possible, I'll ask Trishna for the presentation so I can attach it to our webpage.
Certainly, I would be happy to do.
Yeah, thank you so much, Trishna. This was so informative. This is exactly what we wanted to convey to all our viewers, all the women and the men, of course, because it doesn't just impact the women physically, but also very emotionally to the men, and this is very important to everyone. So thank you so much for being here. You have so elaborately and so nicely, generously shared so much information that we are very grateful for your time.
No, not at all. Anytime, Alam. I was very happy to be here, and thanks for
Yeah.
having me on your event.
Thank you,
And
Trishna.
I just would wish everyone good luck. Thank you.
Thank you so much. See you. Have a good day. Bye.
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 Bye. Bye, everyone.
And that was Dr. Trishna. She joined us from Singapore. So much information, and it's going to be so helpful. We are happy that we could be a part of creating this awareness, and I hope that you have taken back some information that could help you. So thank you for joining today. We are going to come back with a regular show on Wednesday with with Nina Suktankar. She is a childbirth educator. There's a lot of information regarding, your children, your pregnancy, and a lot of tips coming up. So please join us again on our regular show on Wednesday. You have a great weekend, and we'll see you on the other side. Thank you so much. Bye.